Now to move on, we're going to talk about CPT. This is the current procedural technology book. I'm currently using a 2009 as of right now. I don't know what version you guys will have. All right, so now we're going to move on to CPT. This is the current procedural technology. I'm currently using the 2006 version. So the current procedural technology is basically your procedure version of your billing. This is going to have an index to procedures, once again alphabetically, just like looking up a dictionary. And then you're also going to want to cross-reference to the tabular list, which is numerically. Now, accuracy, once again, is the key component to any code for billing. Now, note, the index is located towards the back of the book, and the tabular list is located in the front of the book. It's flip-flopped from your coding books, from your diagnosis coding books. So on your CPT, your procedures in alphabetical order for looking up your index is located in the back of your book, and then your tabular list is located in the front. So that's always a good idea to remember that using CPT, your index is located towards the back of the book, whereas your tabular list is located in the front of your book. Now, moving along, we're going to talk about categories. Now, in your CPT book, there are 3 categories located in finding a procedure code. Now, mainly you guys are going to be working with category 1, especially for this class. I just want to give you an overall basis of what CPT basically is, but like I said, for this class, we're just going to go a brief overview. I don't want to get too in-depth with it. So to begin, we're going to talk about category 1 terms. So this contains 6 main sections. E&M codes, which is evaluation and management, anesthesia, surgery, radiology, pathology and lab, and then medicine. Category 2, this is performance measure codes. This decreases record abstraction, and this is also optional. Sometimes it's easier for a physician to pull, or even a medical biller to pull a category 2 code. Gives a little less information, but it still gives the basis of what the procedure was. This is a little more quicker for physicians. This decreased records abstraction. That way, physicians can just look and pull up a code real fast and see what procedure was done or they need to do. Category 3. All right, so this is category 3. This is emerging technology. This can be used temporarily, but it must be updated to a category 1 before billing, meaning that in case this is an emergency and the doctor needs to know some temporary information, the coder can go ahead and pull category 3 procedures, plug them in so the doctor can see or the physician can see what was done or what needs to be done with the procedure. But then before anything is sent to the insurance company, the biller needs to pull category 3 back and update that to a category 1, which was the 6 main sections we talked to a couple slides back. Some examples. Now, when you're looking up a CPT code, you're going to look up the main term or the subterm, basically the same as you would an ICD-9 code. Now, once again, I'm using the 2006 version of the CPT code book. Second example, arthrodesis of knee. You're going to go to arthrodesis, and then you're going to go down and you're going to find knee, and you're going to cross-reference that to the code 27580. The third example I give you is lung transplant bilateral. You're going to want to go under transplant, lung, and then when you cross-reference that, you'll see where it gives you an option for bilateral, and that answer to that is 32856. Now, once again, I found a video that breaks down the basis of a visual learning of how to look up a CPT code. I highly, highly recommend you to watch this video because it gives you a more visual learning aid of how to look up a code actually using the book in front of you. So with my verbiage here, once again, correlating that to the video I gave you under lectures, you should be more clear on how to look up a CPT code.